Hi, and welcome to Enduring Training for Directly Observed Therapy, DOT workers. My name is Jessica Quintero. I will be providing all the presentations associated with this training. This is Lesson 1, Introduction. A little bit about myself before we get started. I started my public health career in TB as a contact investigator for a large metro health department. Part of my other duties as assigned was providing DOT to patients. I typically provided DOT either to cover one of the DOT workers being out on vacation or out sick. I also provided DOT to patients who required a little bit more time to take their medication, weren't consistently at the location where they said they would be at, or for some reason were a little challenging. That being said, I'm not a nurse. I don't have any medical training, and my training in TB was limited to shadowing one of the DOT workers. Now, as a health educator, I can see that the importance and the value of providing training specific to directly observed therapy workers. And as a student and doing research in the field and research in public health, that importance it's emphasized because of the specialized skill that DOT workers need to possess in order to do their jobs effectively. There's currently no course directed to the directly observed therapy worker. There are presentations on topics that could be relevant, but there isn't really a training for DOT workers. So the reason that we're doing this online instead of in person is because we want to make it accessible. Some of the problem with DOT workers being able to attend training is that health departments have limited funds for training of their staff. And the funds that they do have are typically allocated to the physicians or the nurses who are providing the management of caring for the patient. Time-wise, for those programs that do have funds, they may not have the additional staff to cover for someone being out of the office for training. So doing it via recorded webinar allows for accessibility to view these presentations as your schedule will allow, and it's free. This can serve as a just-in-time training. For those who were like me, that this wasn't part of your job, but you're asked to do it, so you have to learn kind of quickly how to do it. It can serve as a refresher, or it can serve as a training for someone new to TB or DOT. The learning objective for this particular presentation is to describe an overview of enduring training for directly observed therapy workers. I'll discuss the target audience, the outline of the course, the duration for the course, the expectations, and successful completion. This course is targeted to any person responsible or potentially responsible for providing directly observed therapy to a patient with TB disease, TB infection, or those at high risk of progression, such as children under the age of 5 who are known contacts to a patient diagnosed with infectious TB. This can be a person from multiple different settings. You can have someone from a public health setting, a private health agency, a school nurse who's going to be providing DOT for one of her students. Some health departments actually contract out home health agencies to provide this service for them, and those are people who don't typically work in TB. This course consists of 12 lessons. However, Lesson 1 and Lesson 12 are an introduction into the course and a summary out of the course, and those are 15 minutes each. So the actual presentation is about 4 to 5 minutes, and the rest of the time, the 10 to 11 minutes, is dedicated to completing a pre-test and a pre-assessment, and then a post-test and a post-assessment. Lessons 2 through 11 is actually the meat of the training. Those presentations are content specific to the role of a DOT worker. Those presentations will be up to 45 minutes each. This entire course will take about 8 hours to complete. The course can be completed all in one day, or it can be broken out throughout the week. The course outline is Lesson 1 is this one. It's the introduction with the pretest and pre-assessment. Lesson 2 is TB 101 for directly observed therapy worker. Lesson 3 is role of the directly observed therapy worker. Lesson 4 is overview of anti-TB medications. Lesson 5 is providing directly observed therapy. Lesson 6 is providing directly observed therapy, directly observed preventative therapy to children. Lesson 7 is monitoring for side effects. Lesson 8 is tools for the directly observed therapy worker. Lesson 9 is additional duties. Lesson 10 is field safety. Lesson 11 is cultural competency. And Lesson 12 is the summary, post-test, and post-assessment. The expectations for this particular course is you must complete this within 7 days. You'll have from November 9th through November 15th to complete the pre-test, the post-test, the pre-assessment, the post-assessment, and all 12 lessons. You should complete the pre-test prior to starting Lesson 2, complete the pre-assessment prior to starting Lesson 2, complete the post-test upon completion of all lessons, and complete the post-assessment upon completion of all lessons. Upon successful completion of this training, a certificate of participation will be provided to if you met all expectations, meaning you did everything that I just discussed. A letter of gratitude will be provided to all participants, whether you completed all the expectations or at least one expectation. So getting started, you have access to the pre-test and the pre-assessment. Please complete them. You can do it electronically or you can print it out and complete it. Either way, and email them to me at jquin12@wgu.edu. That's jquin12@wgu.edu. Please include your name in the subject line. Thank you.